Good day, I'm Patricia Conde and I will be discussing about diverticulitis. So this will be the content of my presentation. Let's start with the anatomy and physiology and then the epidemiology for diverticulitis. So, ang affected part sa diverticulitis is the large intestine. So, the large intestine has three primary functions. It absorbs water and electrolytes, it produces and absorbs vitamins, it forms and propels feces towards the rectum for elimination. We have the diverticular disease. So, under this, we have yung diverticulosis and diverticulitis. So, ano ba yung diverticulosis? Itong diverticulosis is the small bulging pouches that can form in the lining of your digestive system. So, they are found most often in the lower part of the large intestine. So, ito yung mga bulges. Tawag dyan is diverticulosis. And then, itong mga bulges na to, ang tawag dito specifically is diverticula. So, ano naman yung diverticulitis at anong connection niya kay diverticulosis? So, si diverticulitis is when these pockets or yung bulges or yung pouches or yung diverticula na yon becomes inflamed. So, ito yung itsura ng diverticulitis, yung inflamed yung diverticula. Ito yung mga pouches sa large intestine. So, we have diverticulitis. Meron tayong uncomplicated diverticulitis. Ito yung asymptomatic and then yung complicated diverticulitis naman is yung symptomatic na. Under that, we have abscess, fistula, obstruction, and free perforation. So, again, di ka magkakaroon ng diverticulitis kung wala ka namang diverticulosis. For the epidemiology, meron ako is for diverticulosis. The prevalence of diverticulosis across Asia, with higher rates in the Philippines, Singapore, Hong Kong, and Japan, ranging from 25 to 35%. So, yung Western nations daw are likely to have left-sided diverticulosis, whereas sa Asians naman, right-sided disease. Yung diverticulosis is present in approximately 60% of people older than 60 years old, and diverticulitis occurs in about 10 to 25% of patients with diverticulosis. For the etiology and pathophysiology, we have the age, genetic risk, weak connection tissue, overweight, and bowel movement disorders. So, ano bang mga factors? Yun nga, yung weak colonic wall, high colonic pressure, and dietary factors. Specifically, yung straining during bowel movements or passage of hard stools. Yan. And then, yung low diet fiber, which can be a contributing factor in diverticulosis. Magkakaroon ka kasi ng firmer, smaller stools which require more effort to pass and increase colonic pressure. So, once meron ka ng diverticulosis, possible na yung microperforations wherein yung fecal matter or bacteria can be trapped in this diverticula. When this happens, it can lead to small tears in the diverticular wall. And then, next is yung inflammation. So, as the bacteria multiply in the diverticula, an inflammatory response is triggered. And then, next is yun nga, abscess formation na. So, in severe cases, the inflammation and infection can lead to the formation ng abscess within the abdominal cavity. And then, once may abscess na, if the inflammation continues to worsen, the diverticulum can eventually rupture, leading to perforation in the colon wall. This can cause fecal matter and bacteria to spill into the abdominal cavity, resulting in serious condition called peritonitis. And diverticulitis can also lead to other complications, including bowel obstructions, fistulas, or abnormal connections between the colon and other organs and strictures. Ito yung para sa pathophysiology. Next, for the clinical presentations, it may depend on the location, the severity, and the presence of complications. Pero most common talaga siya sa left lower quadrant ng ating abdomen. So, ang initial symptoms would be abdominal pain, most commonly sa left lower quadrant, and then nausea and vomiting, constipation or obstipation, fever, flatulence, bloating. For severe symptoms, we have fresh blood in your poop, paleness in your face, you feel like you need to pee more often, and your abdomen is rigid and sensitive to touch. For the diagnosis, best test to diagnose diverticulitis is abdominal and pelvic CT scan. It can also help determine the severity of the condition and guide treatment. Others would be colonoscopy, ultrasound pelvis, x-ray ng lower GI tract, blood and urine test, and pregnancy test to help rule out pregnancy as the cause of the abdominal pain. Ito naman yung diagnosis for suspected diverticulitis. For left lower quadrant pain, CT with IV contrast. And then for right lower quadrant pain naman, CT ng abdomen and pelvis with IV contrast is usually appropriate as the initial imaging test for RLQ pain. Kasi ang most common talaga for RLQ pain would be appendicitis. Ito yung Hinchey classification for diverticulitis. Sa stage 1 is yung abscess, yung pericolic abscess. Stage 2 is the distant abscess or sa pelvic. And then stage 3 would be purulent peritonitis. And then stage 4 is the fecal peritonitis. For the treatment, we have for the uncomplicated diverticulitis, pain management, clear liquid diet, and oral antibiotics. And then for complicated naman, we have the pain management and nothing by mouth, IV hydration, and antibiotics ang ginagawa for complicated diverticulitis. And ito ay inpatient management. For the diverticulitis treatment, if usually pagka may frank perforation, abscess, and fistula, usually surgery na. Okay, ang pinaka-common is yung Hartmann's procedure. It is a type of colectomy that removes part of the colon and sometimes rectum. So the remaining rectum is sealed, creating what is known as the Hartmann's pouch and creating an alternative path for feces to be passed. So yun yung pinaka-common. For the antibiotics, for the uncomplicated diverticulitis, ang drug of choice, which is oral, would be amoxicillin plus clavulanic acid. For complicated diverticulitis, ang drug of choice would be same, pero IV naman. And then for recurrent diverticulitis, do not offer an aminosalicylate or antibiotics to prevent recurrent acute diverticulitis. For pain management, paracetamol lang ang binibigay because painkillers like ibuprofen or diclofenac shouldn't be used to treat diverticulitis because they can increase the likelihood of complications such as intestinal perforations. Avoid then morphine if possible because of the risk of increasing intracolonic pressure. Sa diet naman, clear liquid diet, important yan. Low fiber diet, avoid high fiber options like whole grains, nuts, seeds, beans, and popcorn. So, after na mag-improve yung symptoms, usually within 2 to 4 days, you may add 5 to 15 grams of fiber in your diet. And then you can eventually resume your high fiber diet when you no longer have symptoms. For the patient counseling, advise the patient to start a liquid diet, especially during flare-up. Add in low-fiber foods slowly over a few days. OTC pain medications can be helpful, but consult your doctor first. Consider using probiotics and vitamin D to help with gut health. Heating pads may help with pain, and avoid alcohol. These are my references. Reminder, what happens in the gut does not stay in the gut. Thank you for listening.